Hill tackling health care reform, several other issues that will greatly affect our state. Congressman Frank Lucas, who represents our state's 3rd District, joined us now from Washington, D.C. with more. In Congress, let's talk about this health care reform action that's going on and the president's push to try to get something done on it and maybe even a vote by the August recess. Is that realistic?
Well, I don't see how he can get that done, Kelly. He's going to have to make a really incredibly strong presentation to the country tonight to turn this around. When the whip of the United States Senate says most likely it will not be voted on until September, when the chairman of the Energy and Commerce Committee with primary jurisdiction in the House has canceled 2 previous markups this week to take the bill up in committee, I have a hard time believing he can push this bill forward. But the challengers are there. How does he explain the $1 trillion, maybe $1.6 trillion price tag to the American public? How does he explain his way of paying for the bill? There's going to have to be a lot of revenue raised from taxpayers to pay for this. And ultimately, how will the bill make health care better, more affordable, more available for Americans? I can just tell you, when you've got legislation this important, this massive, moving it through at near light speed, which is the White House's goal, is not in the best interest of anyone.
Congressman, has there been any version of health care reform so far that you've seen that looks doable, both from a fiscal standpoint, paying for it, and just actually the mechanism of how it works?
Well, ironically, Kelly, the best piece of legislation I've personally seen so far is the piece offered by our junior United States Senator from Oklahoma, Dr. Coburn, where in essence he wants to use refundable tax credits to make it possible for people to buy their own health care. I think that's probably the direction we really need to go. But remember, the White House and the leadership in the Senate and the United States House have tried to move this much in the same way they move cap and trade, in a hurry, with as little input as possible. And that's not the way to craft good law. Every member, both Republican, Democrat, from every part of the country should have a say, should have an opportunity to affect this legislation, because it will impact everyone. Everyone will be impacted by this.
Congressman, you mentioned cap and trade, and let's talk about it. I know you've been very concerned of what this cap and trade legislation would do to Oklahoma farmers.
Well, it's Oklahoma farmers right between the eyes, so to speak, because we are intensive users of energy. Whether it's the tractor diesel or the gasoline in the trucks to haul the crops, the energy required to make the fertilizers, the chemicals, prepare the seeds, the processing that comes after the harvesting, delivery to the stores, the coolers to keep the products safe and attractive to consumers. We are intense energy consumers, and the way this bill is put together, agriculture was only really mentioned in an amendment that was offered at 3 o'clock in the morning for consideration by the House the next day before the bill passed. And if agriculture is not enough, remember, Kelly, their goal is to dramatically reduce the consumption of traditional forms of energy. If you're in the oil and gas business in Oklahoma, that means they want to do away with your job. That is a threat to our economy. Bottom line is, we all care about the environment. We all care about the future of this globe. But we need to do things in a way that move us forward in a positive fashion, not use the tax man and government interference and to create a system to force us to live our lives and do our businesses dramatically different than we do now. And that means pay more for less.
2 quick predictions, quick ones. Will health care reform pass before the end of the year? And secondly, will cap and trade pass?
I hope cap and trade doesn't pass. But I've watched how hard the White House worked to pass cap and trade, and they're going to make an all-out shove on health care. So can we stop it? We'll see. But they're going to try everything within their legislative trick bag to force this through on the American people.
Health care reform?
Yes. They will attempt the same kind of intensity. I hope in its present form it doesn't pass.
All right, Congressman. We appreciate the time. I hate to cut you off there. We'll look forward to the next time we get to visit with you. Congressman Frank Lucas today talking about cap and trade and also health care reform and what's going on in Washington right now. Amy, back to you.
All right, Kelly, thank you.